Well, we are heading into our third fall with COVID-19, but some people are still experiencing symptoms from months or even years ago.
That's right. It's called long COVID, and it affects millions of people. For today's Wellness Wednesday, I spoke to a Boise doctor who says help is available.
The CDC recently releasing a report that says of the nearly 24 million adults in the U.S. who currently have long COVID, more than 80% have trouble carrying out basic day-to-day activities. I spoke to Dr. Jody Donovan, medical director for St. Luke's Long Haul COVID Clinic in Boise.
We've now had COVID-19 around for at least a couple of years, and I've been seeing patients with long hauler type symptoms from each of the major surges that we've had, both with the Alpha variant, which is the one that initially came out in 2020, with the Delta variant, and then also the Omicron variant here recently.
So how long does COVID typically last? According to Johns Hopkins, mild or moderate COVID-19 lasts about 2 weeks for most people, but others experience lingering health problems even after the fever and cough go away and they're no longer testing positive.
That, I think, is the hardest part about this illness, is that I see some patients that say, I've been struggling with these symptoms since January of 2020, when we didn't even have testing at that point in time for COVID-19.
So what symptoms do patients report? Long COVID can include shortness of breath, cough, persistent chest pain, heart palpitations, brain fog, and fatigue. Dr. Donovan says it varies person to person.
I am seeing probably more respiratory or more lung issues with the initial strain that came out in 2020, and then also the Delta variant, because we were seeing a lot more patients, of course, in the hospital with pneumonia. So those respiratory type cough or shortness of breath symptoms I tend to see those more with the variants that were earlier. But I would say that a lot of these symptoms are just really devastating for people with any variant.
And what about taste or smell? A 2022 study published by the BMJ suggests 5% of adults who report initial changes to their sense of smell or taste after COVID-19 may go on to develop long-lasting smell and taste problems. Recovery rates did increase with each passing month. So, if this sounds familiar, Dr. Donovan says St. Luke's is here to help and insists you're not alone.
I can't tell you the number of times that I see long COVID patients and they say, I always thought I was crazy. I talk to people and they don't understand what I'm going through.